Hello and welcome back to our weekly stats report. My name is Sara, epidemiologist at the Jefferson County Health Department. Tonight we are going over the week 40 COVID-19 data. The CDC week 40 covers data from Sunday, September 27th to Saturday, October 3rd. The weekly total COVID-19 surveillance report includes our community-based cases as well as those long-term care facility cases. During week 40, we had a total of 359 confirmed and probable COVID-19 cases in Jefferson County. Our year-to-date total is 4,813 cases as of Saturday, October 3rd. We are reporting 65 COVID-19 associated deaths, as well as 19 outbreaks in the long-term care facilities. Outbreaks in those long-term care facilities are defined as one or more confirmed cases of COVID-19 in residents or staff. Starting with Table 1, you'll see the number of confirmed and probable cases by week. Column 1 shows the CDC week, and in Column 2, you'll see the CDC week start date. During week 40, we had 359 confirmed and probable cases, which was a decrease from the number we reported during last week, week 39. This is our second week in a row where we have seen a decrease in our weekly case count. So thank you to everybody who has been working very hard to do their part to stop this spread in our community. We definitely still have quite a bit of work to do though, so please continue to practice those mitigation strategies and be sure to stay in contact with us for the latest updates and recommendations. Our table here does include both lab confirmed and probable cases. The lab confirmed cases include those individuals who receive a positive result from a diagnostic test, and those probable cases are very important to include in our count because they are individuals who have met two very specific criteria. One, they were a direct contact of that positive case, and two, they have become symptomatic since having been in contact with the positive case. So that likelihood that they have COVID-19 is very, very high. They do have a direct link with a positive case and are actively ill. They may just be waiting on a test result or have not yet been tested. In Figure 1, we see the confirmed and probable cases by week in bar graph form, which helps to show how our weekly case count is moving. The data has been moving downward for the past 2 weeks, which is definitely promising. The next chart shows a breakdown of the daily case numbers and the 7-day rolling average of cases. The dotted line is the number of daily new cases, which, as you can see, it does fluctuate from day to day. That solid blue line is the 7-day average, which helps to smooth out those fluctuations in the data. This 7-day rolling average is one of the main indicators that is used for that color guidance chart for our county. Because of that nice drop in our 7-day average of cases, our county is now back in the orange status. As far as those color status guidelines go, we are looking to stay under a 7-day rolling average of 25 new cases per day per 100,000 residents. So without using that per 100,000 resident rate, which I know can be confusing sometimes, if we are just going based off of the 7-day rolling average of daily new cases, we need to keep that number right around under 56 cases per day to stay in orange. Next, let's look at the overall age group data in Figure 4. Once again, the 20 to 29 year age group still has the highest number of cases with 800, and the 80 plus age group still has the highest rate per 10,000. Most of our age groups only experienced a small increase in cases from last week. And when I say small, we are talking less than 10%. Two groups, our 30 to 39-year-olds and our 60 to 69-year-olds, saw the highest increases during week 40. But even so, those increases were only just above a 10% increase. In Figure 5, we will be looking at the fatalities and the fatality rate by age group. There are now 65 reported deaths in our county, most of which have been in our 80 plus age group. Our cumulative fatality rate is now 1.35% in Jefferson County. This rate is lower than both Missouri and the US. Missouri's fatality rate is 1.63%, and the fatality rate for the US is 2.84%. Moving on to figure 7, we have the COVID-19 PCR test results by week, as well as a visual of that percent positive rate. This data only includes those lab confirmed cases, so the number is going to look different from our main weekly case count because it does not include the probables. The dark blue dashed line represents our percent positive, and right now it is around 11%. Table 3 is where we can see the total number of positive tests, negative tests, as well as the values for our weekly percent positive. During week 40, we had 309 lab confirmed positive cases. This number does not include the probable cases and also does not include any duplicate test results. Each individual person is only counted once, no matter how many positive tests they receive. The percent positive for week 40 is 11.1%. This number will likely change over the course of the next week or so as we continue to get those negative test results in from the state. Moving on to table 4, the COVID-19 cases are divided up by race and rate per 10,000 residents. The white population in the community has the highest number of cases with 3,458, as well as the highest rate per 10,000. As a reminder, we do not include any missing or unknown race data when we are calculating these rates. For the zip code data this week, we can see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and are in the process of completing their isolation or their quarantine period. We have had a few areas who have noticeably higher amounts of cumulative cases than other areas. Many of these same areas also have a high number of active cases at the moment as well. Arnold 63010 has 163 active cases. DeSoto 63020 has 148 active cases. Festus 63028 has 144 active cases. And Imperial 63052 has 137 active cases. For the last piece of our main weekly surveillance report, I always like to show our cases by zip code per 10,000 residents. This rate per 10,000 takes the population of each individual zip code into account, so this does help to give a fairer comparison among some of those areas who may have higher populations or smaller populations. Herculaneum 63048 is that area that you see there with the highest rate per 10,000. This area experienced the highest increase in cases last week with a 17% increase in total cases. For our hospitalization data this week, we are once again going to take a look at the data we received directly from our local hospital systems. What is presented to you in this hospital report is meant to give you a snapshot of what is occurring in our community, but it certainly should not be used in any context that would imply that these are the only hospitalizations that are happening in our community. This report only includes data from 2 of the 3 main hospital systems. And in this particular report, we define a hospitalization as any time the hospital is utilized by a positive COVID-19 case. As of week 40, a total of 369 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 48 of these cases have been admitted into the ICU, and 23 positive COVID-19 cases required ventilators. In figure 1, we see the COVID-19 hospital admissions and a 7-day average of those admissions. We had a dip in admissions right around mid-August, but they have been continuing to rise up until this past week, where you'll see that second big drop in admissions. We want to take into consideration that sometimes there is a little bit of a lag in the data when it comes through, which is why those trends can be best seen over an extended period of time. Next, we will take a look at the length of hospital stay. We have had a cumulative total of 145 emergency room visits. There are currently 29 Jefferson County residents who are still in the hospital at either BJC or Mercy facilities and are COVID-19 positive, which is a small decrease from last week's current inpatient count of 31. And most of our hospitalized residents are staying in the hospital for around 1 to 2 days. Next, let's take a look at the current school-aged population data. As of week 40, there have been a total of 670 lab confirmed and probable cases in the 0 to 19 year age group for Jefferson County. In Figure 1, we see the number of confirmed and probable COVID-19 cases by week for the 0 to 19 year age group. And during week 40, there were 55 cases reported for the 0 to 19-year-olds, which is a pretty significant difference from the highest weekly total that we saw back in week 38. This is most definitely a promising sign when it comes to those cases in our youth population. In Figure 2, we have the cumulative cases and active cases by zip code for our 0 to 19 year age group. And again, let's focus on those orange active cases. So the cases that have not yet been released from isolation or quarantine. 3 areas have more than 10 active youth cases. Those areas are DeSoto, Festus, and Imperial. And lastly, let's review the weekly community-based surveillance report, which excludes the long-term care facilities. In Figure 1, we see the weekly case count excluding the long-term care facilities, and during week 40, 341 cases were community-based cases. Only 18 of our cases this past week were found in those long-term care facilities. Those cases do come from both the residents and the staff of those facilities. And just like our main weekly surveillance report, the weekly case count has decreased from our week 39 case count. And we certainly hope that we can continue this downward trend with the help from everyone in our community. When we look at the age group data for our community-based cases, once again, that 20 to 29 year age group has the most cases with 753. The 30 to 39, 40 to 49, and 50 to 59 age groups are not too far behind, though, in number of total cases, and they each have totals in the 600s. The last of our graphs that we will look at today include the zip code data excluding the long-term care facilities. Similar to our main report, including both community-based cases and the long-term care facility cases, the same 4 areas have a high amount of cumulative cases for this year. Arnold, DeSoto, Festus, and Imperial all have above 400 cumulative cases, with our highest being Arnold, whose week 40 cumulative total sits at 623. Before I leave you this evening, just a quick little reminder that flu season officially started this past week during week 40. Your annual flu shot will not only help protect yourself, but also those around you. Please be sure to refer back to our website, jeffcohealth.org, for more details and recommendations on COVID-19, and refer to the COVID-19 dashboard on our site for the latest data. Leave us any questions that you may have in the comments or reach out to us via direct message. Have a safe and healthy rest of the week, and thanks again for spending this time reviewing the stats with us. Have a great night.